All right. Hello, I am Joanna and I'm a speech language pathologist here at Falmouth Hospital. I am going to talk to you today about the stroke dysphagia screening protocol. So I'm just going to give you some pieces of information to start. So if we look over here, you can see that we had some good statistics. There's really good information out there and research that's been done on the importance of screening after strokes. They found in one study that included 222 hospitals from 6 different states that we're actually not reliable in knowing when a patient should or shouldn't be screened for dysphagia. And that really is just kind of reaffirming the fact that we should be screening all of our patients. We do universal screening at our facilities, which is in line with this research. So the other pieces of information that we have here is that with the data from Get With The Guidelines is that 1 in 5 patients with acute ischemic stroke did not receive a dysphagia screening. And when we saw that they did do the screening and they failed, it was a really strong predictor of pneumonia, disability after their stroke, and eventual death. And of over a third of patients with mild stroke who failed their dysphagia screening despite appearance of only mild symptoms, the failed screen was still a stronger predictor of higher incidences of pneumonia and disability afterwards. So even though their symptoms overall with the stroke seem mild, the dysphagia can be really disabling for them. We have limited research overall just because we can't really exclude people purposely for research purposes, but the data that is available based on the screenings we do is really beneficial to do these screenings. The other thing we have is the Yale Swallow Protocol. Information about this Yale Swallow Protocol, which is really what we're basing our stroke screening on. So the Yale Swallow Protocol research is really, really good. There's a lot of reliability, the sensitivity and specificity of the test is really good. So we use this to determine whether or not our patients should be further evaluated, okay? Just little other pieces of information about dysphagia that we have available just for you all to know if you're working with a speech language pathologist. We're looking at 3 phases of our swallow. So you have your oral phase, which really includes sucking, chewing, moving food and liquid from your mouth into your pharynx. Our pharyngeal phase really has to do with moving the food and the drink from our throat. Also deals with airway closure and making sure the food and drink go through into our esophagus and don't hang out in our throat afterwards. And our esophageal phase, which is really the food and drink moving through our esophagus and reaching our stomach. So there are 3 phases that we assess. Little extra pieces of information. If we say that your patient is penetrating, they're really having food or liquid go just above their airway. So it goes into the larynx above the vocal cords. And if they're aspirating, we're seeing it move past the vocal cords. Even in trace amounts, this would be considered aspiration. So those are the things that we'd be looking for with our stroke patients as we go in and we evaluate them afterwards. But the frontline person is always going to be you. So it's important for you to be able to go through and do the screening appropriately. So we start by looking at patient history. So if you have a patient who comes into the emergency department and they have any vague neurological symptoms, they're clearly being put on our stroke map and you're going to screen them. Then you're going to look through their history and make sure, one, that they don't have a history of dysphagia already and already require thickened liquids, right? We don't want to give them a 3-ounce water challenge with thin liquids if they're on thick at baseline. The other thing you're going to look at is see what their alertness is like. Are they appropriate to participate in a 3-ounce water challenge? And then we are looking at their oral mechanism. So you can have a quick assessment for facial symmetry, have them move their tongue around, and also just to look for labial motion and closure. When you are done with those parts of the screen and you feel like they're appropriate to move on to the 3-ounce water challenge, we're going to be sitting the patient upright. We're going to give them a 3-ounce cup of water. So it's just going to be a 3-ounce cup like this. And you're just going to ask them to drink it down continuously, no stopping. If the patient stops to take a breath, if they start to cough, choke, even up to 2 minutes after drinking the water, then that constitutes a failure on the screen. If they fail, contact the admitting provider or the emergency department provider that's on board with the patient at the time. Request an order for NPO, strict NPO. That means no medications as well. And also an order for an SLP clinical swallow evaluation order. And you can always rescreen the patients. We know that with stroke, patients can get better or worse as the stroke evolves. If we feel it's appropriate to rescreen the patient, you can always redo the water challenge. Sit them upright, ask them to drink the water down, and monitor for symptoms. If they fail, then they stay NPO. We'll already have the orders in place. If they pass on a rescreen, then we're asking the physician to resume their baseline diet. SLP order will already be in, and we will still go and proceed with our consultation just to be sure that everybody's on the right page together. All right, but we're going to demonstrate doing the screen next. Hi, my name is Joanna. I just want to ask you a couple of questions to start. Can you tell me what's the date for today?
June 22nd.
22nd.
Great. And can you tell me where are we at right now?
We're in Falmouth.
Okay, great. I am just going to ask you to make some facial movements for me if you can really quick. Can you stick your tongue out for me? Good. Can you move your tongue up towards your nose? Good. And how about over towards your left side and over towards your right? Good. Now, I just want to see, can you fill your cheeks with some air? Good. Very nice. Good. Looks really good. I'm going to make sure that you're sitting up. You look like you're sitting up nice and tall. And what I'm going to ask you to do next is to take this cup of water and to drink without stopping until all the water is gone. Okay? Just keep taking one sip after the other until it is all done. Okay, we can stop right there. Thank you very much. So I'm going to document that as a fail. I'm sorry, but with your coughing, I'm going to go talk to the doctor. We're going to make sure that we get the speech therapist to come in and do a further evaluation of your swallowing. We're not going to be able to eat or drink until the speech therapist comes to evaluate you, or until we think you're maybe looking a little bit better and we can retry this later. Okay. Hi. So I'm just going to ask you a couple of questions really quick. Can you tell me what's today's date?
June 23rd, 2022.
Very good. And can you tell me where are we at today?
Falmouth Hospital.
Awesome. And I'm just going to ask you to make a couple of movements for me really quick. Can you stick out your tongue? Good. Can you reach your tongue up towards your nose, down towards your chin? And can you move it side to side for me? Very good. And how about fill up your cheeks? Fill them full with air. Perfect. Very good. All right. I'm just going to make sure that we're sitting upright really quick. Very good. And I'm going to ask you to take this cup of water from me. I'd like you to drink all the water. Don't stop sipping until it's empty. Great. And you're feeling good after that?
Yeah.
Good. So I'm just going to wait a little while, right? Once we know that 2 minutes has passed, All right, great. So you did really good with that screening, and I'm gonna ask the doctor to let us order your food. At home, were you eating any food, regular food, without
Yeah.
any restriction?
Yep.
Great. So we'll make sure we get the doctor to order that regular diet for you as soon as he can.
Awesome. Thank you.
Okay, so we're gonna click into the patient's chart here. To find the dysphagia screen, we're gonna go into flow sheets at the top. And then on the right side of the screen, we're gonna go to the search bar. And this will bring up the search bar in the middle. And you're gonna type in dysphagia. So here it comes up with dysphagia screen. We're gonna click and accept. So it gives you two options on the right side of the screen here. You can either, if you're in the emergency department, you will do the emergency center assessment. The inpatient unit, that's what we're gonna focus on, is inpatient option. So this is where you can click inpatient unit. At this time too, you can also adjust the times of your assessments, whether you did it previously, so just be sure to do that for an accurate assessment, and you can do that by adding a column. So the assessment starts with, of course, the location and time of assessment, and then it brings you down to, since symptoms were discovered, has the patient had any oral medication or food? We're gonna say no. And that will bring you to the patient history. So this is when you're gonna go back, you're gonna either ask the patient or look in their history, do they have any history of stroke with residuals, head injuries, neurological diseases, etc., or none of the above. For this case, we're gonna go stroke with residual, and that's gonna bring us down to proceed to section 2 with caution according to orders, and we're gonna press enter. This will bring us to section 2. So this is when we're looking at the patient. Are we observing any signs or symptoms of dysphagia? So this will prompt you with some options over here. Any respiratory distress, drooling, abnormal voice, facial droop, slurred speech, any of these options other than none of the above will prompt an automatic fail. So in regards to the fail, that's when the nurse will contact the provider and ask for a strict NPO order. In this case, we're gonna do none of the above. And this is when you can proceed with giving the patient 3 ounces of water in one continuous drink to do the actual dysphagia screening. So once you give the patient 3 ounces of water and observe them for 2 minutes, if you observe any coughing, throat clearing, drooling, multiple swallows, things like that, that is gonna be an automatic fail and also cause you to contact the provider for a strict NPO order. If we click none of the above here, that's gonna be an automatic pass. And again, I'll just show you. If we clicked throat clearing and drooling and enter, it brings you the option to fail. We're gonna do yes, fail. And that is the dysphagia screen.